Hey guys, Dr. Eric Gifford with Evolution Health and Wellness Center. We wanted to come to you today to explain some changes that we're going to be implementing, particularly with our hormone optimization going forward. Let's jump right in. Basically, I want to tell you what we typically do with our lab values. So, our hormone levels, we want a baseline lab value. The baseline lab value basically consists of where your hormones are when you come to us when you're starting your journey with hormone optimization. So we want to know how low your testosterone is or how low your estrogen is, and we need to know like where your starting point is, so that way we know how much of various hormones we want to replace or optimize. Once we you know do a pellet procedure where we place either testosterone or estrogen or both, we're then going to check a peak value. Now, a peak value means that this is about as high as your levels are going to get once you've been pelleted. So we're going to check within 4 weeks on our guys and 6 weeks on our women to make sure we know exactly how high your levels got to. Now, the new one that we're going to be introducing, this isn't new, it's just something that we're going to be implementing into our program, is a trough value. Now, a trough value is your lab levels at the end of your pellet cycle. So in women, we're talking 3 to 4 months as that pellet has been almost completely absorbed or dissolved, and now you're getting close to back to your baseline. In men, same thing. Between 4 to 6 months, you're going to see that level, finally start to decline at the end of the cycle, and that's where we want to know what your trough value is. Why is this important? So, what we have found over the last few years of doing our hormone optimization is that most commonly, I would say the most common side effect of hormone optimization is getting your levels either too low or too high. And for women, if we get your testosterone too high, we may see some excessive hair growth. We may actually see some hair loss. We may see just effects that you're not trying to get, even weight gain with too much estrogen or migraine headaches. In men, if we get your testosterone level too high, you may have more acne. You may have again more excessive hair growth, hair loss. These are all the things that we don't really want to have happen. We want the testosterone and we want the estrogen replaced because we want to feel great. But if we go too high or too low, again, sometimes we're actually counterproductive and we're causing more problems than we're fixing. So what was happening, and the most common thing that we would see happen would be what we refer to as stacking. And that means whenever your first pellets are still in there, and they're still being absorbed, and then we give you another set of pellets before they're completely exhausted. Well, now you've got two pellets, and that gives you a level even higher. And so we were getting levels that were a little bit more than what we want, and again, potentially causing side effects that you don't want. And so going forward, we're going to be implementing this program where we're going to be checking not only your baseline, your peak values, but also a trough value to make sure that it is appropriate for you to get your next pellet insertion, so that we can avoid the stacking phenomenon that has been occurring in some of our patients. And this is just a way that we can help ensure that we're getting you optimized, keeping you optimized, but also not going too high. So again, the updated protocol is going to consist of initial hormone levels prior to optimization to get a baseline value. We're going to then check your peak hormone levels at 4 to 6 weeks to ensure that we got your optimal levels. And then we're going to obtain those trough values. For women, it's anywhere from 12 to 14 weeks. And for men, it's going to be 18 to 20 weeks to verify that it is appropriate to give you your next pellet, or that we can do your next pellet procedure. Uh, the next thing I would say on this is these are maintenance labs. And once we get your levels optimized, and we know exactly where you're at, and you've been here for at least 2 cycles, then we're just going to check peak values on an annual basis. Now, anytime you feel a change or experience a problem, then checking your levels may be perfectly appropriate, and we don't mind drawing labs anytime on patients to make sure that we are, doing the right thing. Anytime a change is made to your dosing, again, we would like to check hormone levels there right after to make sure that we did get your levels to an optimal place. Lab pricing, we're not really changing much. This has kind of been our program all along. Your initial labs were covered under a comprehensive panel, and that was $150. Now, for maintenance labs, this includes trough values, or again, if you had a change or you were having a symptom and we wanted to check labs to make sure that everything is still good and that we're happy with your levels, is going to be $100. It's not quite the full comprehensive panel, but it still has quite a few labs in it. And again, that will help us make sure that you are on the right course and that we're optimizing your hormones appropriately. So the last thing I'll say on this is that everyone is still different, and each patient is going to be considered on an individual basis. These changes are being implemented now, and they're going to be kind of on a rolling basis. So going forward, this may affect your current or your next cycle. But if at any time we think someone may be, too low, too high, or something indifferent, then we may go ahead and say, hey, let's check a different level and let's make sure that you are where you need to be. But if somebody comes in, this is where this gets confusing. Is the idea is that we're going to do 12 to 14 weeks for women and 18 to 20 weeks for men. But sometimes people may feel that their pellets really have already dissolved and they're not getting the levels where they wanted to be. And we can go ahead and check you earlier, but that's going to be on an individual basis. But on average, we're going to check 12 to 14 weeks for women and 18 to 20 weeks for men. So if you have any questions about this going forward, obviously this is I'm going to say a significant change, but it is a change to our current system. Reach out to us. We're happy to walk you through this and explain what we're doing and why we're doing it. But hopefully this video kind of clarified what we're doing and why we're doing it, so that we preemptively answered most of those questions. But if you still have any concerns, give us a call. We're happy to help you out anytime. So we'll see you soon for your next pellet procedure.